Welcome, everyone. Welcome to our Mental Health Kansas City Presents webinar series. We're so glad you guys are here. I'm Jamie. I am with the Metro Council, and a little bit about us and kind of how Zoom webinar works. Good afternoon. We're so glad all of you are here today. Just a couple things to kind of note about Zoom webinar, just because we're getting a couple of questions about it. So with Zoom webinar, you'll only be able to see the presenters, not yourselves. So your cameras won't work. You'll only be able to see the presenters and the slides that they present, but you will be able to communicate through the chat box along with the Q&A. And then at the end of our session today, I will be giving you all the link and the password to get the certificate of attendance with one contact hour. And I always have to say that the views and opinions presented are those of the speaker and don't necessarily represent the opinions of Metro Council. But let me tell you a little bit about Metro Council first before we get started. So Metro Council is a collaboration between all the community mental health centers in the Kansas City Metro. So that includes Johnson County Mental Health Center, Wyandotte Behavioral Network, University Health Behavioral Health, SWOPE, Rediscover Mental Health, Comprehensive Mental Health, Beacon Mental Health, which used to be Tri-County, along with Mental Health America, the Heartland, and Center for Behavioral Medicine. So all of us make up Metro Council, and we have educational presentations, educational information for the public, along with information for the community to hopefully reduce stigma around behavioral health. So some of the things that we offer include free webinars on the second and the fourth Thursday of the month from 12 to 1. You're here today, so thank you all for being part of that. We also host a thing called Therapy Thursdays on the third Thursday of the month with Box 4. And then we also have our very large Mental Health Kansas City Conference. If you don't know about it yet, please save the date. Mental Health KC Conference happening May 23rd and 24th at Johnson County Community College. So we have a new location this year. We're really excited. We have two national keynote speakers. Dr. Corey Keys will be speaking about languishing and on Thursday, and then Wesley Hamilton, who founded Disabled, but not really, here in the Kansas City area. He is going to be talking about overcoming adversity. And I don't know if anybody has seen Queer Eye for the Straight Guy, but he was on Queer Eye for the Straight Guy in Kansas City. So we're really excited to have those two keynote speakers. We also have 70 breakout sessions. So you will get to pick from a lot of different options, and we hope that individuals can join. It is only $50. I say that because that includes 8.25 contact hours, lunch, snacks, and as I said, like two keynote speakers, 70 breakout sessions. And while everything else has gone up in price, we have not. So we hope you all can join. So with that, I'm really excited to introduce Jordan and Rachel and Geneva and Jordan. And let me just tell you guys a little bit about them. So, on one second. There it is. Okay, so a little bit about Jordan. So Jordan Bowe is the team leader in Children and Family Services at Johnson County Mental Health Center. And let's see what else. Hold on. There we go. She's certified in trauma-focused cognitive behavioral therapy and pursuing certification in attachment-based family therapy. And she's worked in the mental health field with adults and children for over 10 years. And she currently supervises a team of clinicians and case managers. And then Geneva is the pediatric wraparound facilitator and a health navigator, and has been working in human services in various roles since 2013. And she She recently completed 500 plus hours of SED counseling training. And then she also advocated for Johnson County Mental Health Center Sibling Connect. And then Rachel McDonald is the parent support specialist. And she has over 20 years of experience working with children and families to support mental health and educational needs, and has been a parent support specialist at Johnson County Mental Health Center for over 5 years. And also has developed many groups and programs to support parents and caregivers of children receiving services. She's also a parent project facilitator. And then Jordan is a parent support specialist and has over 10 years of experience working with and providing community-based services to at-risk youth and their families. And he recently transitioned to the role of parent support specialist at Johnson County Mental Health Center, but prior to that, worked as a children's case manager on the youth forensic team. So with that, I'm really excited to introduce everyone. So Jordan, take it away.
Thanks, Jamie. Let me go ahead and share. Maybe if I could get a thumbs up of, you can see the slides. Okay, awesome. Okay, so thank you. Like she said, I'm Jordan Books. I am one of the team leaders with Children and Family Services. So we're all really excited to be able to come on today and talk a lot about just what we're extremely passionate about, which is supporting kids and families. And so we're going to talk about a lot of different things, but really what we are hopeful that at least some of you all leave with is just how important supporting parents is in the change process, in supporting kids' mental health, the family, system as a whole. Parents are really the key in making sure that everyone's needs are met. So we're going to talk a lot about our services. I'm guessing today we have some parents on. I can't see anybody, but I think we have some parents, probably some mental health professionals. I'm guessing some parents that are also mental health professionals. So really, we are hopeful that you all will at least get something from hearing about our services, but also about mental health, how that impacts a family system in general. Okay, so we're going to go over just basic Johnson County Mental Health Center. We offer a ton of different services. So geared toward children and families, our division really focuses on providing therapy services for kids, case management, medication services, really ranging anywhere from age 3 to 18 with severe or mental health struggles that really impact someone's functioning. So we want to be able to provide services that keep kids at home, in the community, being able to thrive in their home environment, but also in the community and in their school environment. We provide the case management, therapy, and we have a few different types of specialized therapy that I'll talk about in just a minute. Medication services. We also provide psychosocial groups that really focus on providing kids, tools, social skills to manage, their mental health in a variety of different settings. And then we have parent support, which is going to be largely focused on today during our presentation. That is a service that is provided, in general with our services. Like we like to support parents, but parent support is a service that's specific to the SED waiver, which is a program that we also provide through the Mental Health Center. Okay, so therapy. We do individual therapy, family therapy at the Mental Health Center. There are a few of our clinicians that are also more specialized training in trauma-focused CBT. And one of our more recent is the attachment-based family therapy, which we have found a ton of success with just working with kids and families with that therapy model. We have several, including myself, clinicians who have gone through the training and potentially working through that certification process. But it really focuses on just how important the parent and child connection is, which is a large focus of our parent support services in general, is focusing on supporting parents and building that connection with their kids to then be a support in managing their mental health. And we also have a team that provides functional family therapy. Okay, so there's a lot of words on this slide, but really it's just an overview of all of the different services. So we're really fortunate that we've had several people, Rachel, Jordan, Geneva, myself, that are just really passionate about supporting parents, being able to support parents to then support their entire family. And so we have our division director, Janie, which I think is on here. She's really supported us over the past 5 years to build our parent support services, add new services, emphasize really our ability to go further than the mental health center, so providing resources and support in the community. And these are a list of the services that we're going to go over today. So first, we'll talk about our individual parent support services, which individual and group really are like the key of where we started with parent support services. And then from there, we branched off to providing Parent Connect, which is open to the community, as well as Parent Project, which is more of a skills kind of coursework-based program that we've provided to clients of the mental health center and also offered to the community. And then Family Mant that we offer our parents of clients that we serve. And then our newest, which Geneva will talk about a little bit more later, is our Sibling Connect. Okay, so I think the unique thing about our parent support services is that we try to provide this service at the beginning of treatment. So really involving parents from the beginning all throughout treatment to, again, just emphasize the importance of parents being involved and getting their own needs met to support their kids. So Rachel McDonald and I, gosh, has it been 3 years? Maybe even 4. We put this together. It's the Parent Skills Inventory. This is a self-assessment for parents to be able to go through with their provider to really rate themselves, where their confidence is at in a variety of different parent-focused areas that really impact mental health and functioning. So when we first start providing individual parent support, one of our parent support specialists, so Rachel or Jordan, will meet with a family at the beginning of treatment to complete the parent skills inventory and really just assess like what their needs are, where they feel like they're at in all of these different areas. And then from there, we would make recommendations on what level of parent support that parent or family system would benefit from. So that can range from individual parent support groups, or also getting involved in our other parent services that I had just listed on the previous slide. So the cool thing about this inventory is, as you can see, diagnosis education, parent-child relationship, crisis planning, parent strategies, these are all really important and will ebb and flow as a kid, goes from young age all the way up through their teen years. A parent might feel really confident, with knowing their kid's diagnosis, but they might really struggle in providing their own self-care. So being able to, manage all of the things that as a parent, you have to manage. And so this gives us an idea of where the parent feels like they're at and where we can be most helpful to them. So we know that parents coming into, mental health services can be coming at, entry point at any time. They could be coming in after, years and years of struggling with mental health. They could be coming in right when, their kid gets a diagnosis and they're not really quite sure where to start. And so we really want to empower parents because they're the ones who have been living, their life with their kids. They're the expert on their kids, not us. And so this tool really helps us understand like what resources is the parent and the family kind of bringing to us. What do they already have that is working for them? We want to empower people to use their strengths, their kids' strengths, to be able to come up with a plan that they're comfortable with and that really is going to be meaningful to them. So one of the best things about this is it gives us a starting point. And then from here, the parent skills inventory, then we move toward using our parent support services guide that really dives into all of these 6 areas of parenting. So the next few slides, I'm going to go over some handouts. Our services guide really is like 60 to 70 pages long of resources, handouts, activities that a case manager or a therapist can work with the parent or the caregiver to really explore those 6 sections based on maybe what their highest need is. And so you're going to hear a lot about attachment today because that, is crucial and really a big piece about what we do with families. So this is just a snapshot of one of our activities that is part of our parent support services guide. And again, really just emphasizes that parents are the key to being able to support their kids in meeting their mental health needs. So when there's maybe a gap in attachment with the parent and child, or something that's getting in the way of that trust and that bond, the child is going to be impacted, but also the parent's mental health is going to be impacted. And so whenever there may be something going on with someone's bond or attachment, that child or teenager potentially might not feel like they can go to that person for support. And this can be anyone, really. This can be, a parent. This can be a grandparent that's caregiving. This can be, a mentor. It's really important for kids to have some sort of, parent figure or caregiver that they can trust, that they know is going to be able to help navigate when things get really hard. And so building that attachment is important to really then be able to communicate effectively together, but also just knowing for that child or that teenager that they can go to that person when things get really hard or when they're experiencing suicidal ideation, self-injurious behaviors, substance use. Those are the times where we really want a parent to be able to lean in and provide, that safe communication and support for kids and siblings. These are just a few ideas, activities for building attachment. Really what we talk about is just being intentional about it. So planning time to be able to spend together that's like non-contingent. So not based on a child's behaviors, whether they're doing well or perceived as not doing well. So carving out time to spend together, doing things that both enjoy, but also, sometimes where parent might have to give in a little bit and do something that they might not quite enjoy so much. But doing like physical things together can be even as simple as, sitting next to each other on the couch, watching TV, brushing your child's hair, playing games together, but really being intentional about building that attachment. Okay. So again, just another area that we focus on is helping the family figure out a routine that is good for them. So not maybe over planning for things or over scheduling. I know, especially I think in Johnson County, that is a huge problem that families face is there is just never seems to be enough time in the day to get everything done. So helping a parent or caregiver sit down, really prioritize and make sure that they have a routine that feels good for them and their child, and then being able to support that parent when things might go awry. I don't know about you all, but sometimes with parenting, I'll feel like, okay, I got this. This is going really well. And then I might cut my toddler's toast incorrectly, and then the whole day is ruined. So I think it's just really important to help support families in finding a routine and schedule that works for them, and then planning for any, barriers, crises that come up to then navigate or get additional support when needed. Okay, so I've already talked a little bit about this, but as parents, we often put everyone else first, especially our kids. So usually we might not notice when, ourselves, our mental health is not so great, or, we just don't have balance in different areas of our life. We might not notice that until might be a little too late, where we're really stressed out, really not communicating effectively. And so we work with parents to explore different areas of their life, maybe that they don't feel are going as well, and trying to balance that out. So, I encourage you all to just look at this. This probably resonates with a few of you, I would guess. You don't have to answer this question, but just think to yourself, any of these areas, have you thought about this recently? Are any of these causing you a lot of stress? Maybe it's your career, maybe it's finances. Do you feel like you have balance, or that your needs are met in each of these areas? I would say probably not a lot of people do feel like they really have balance in all of these different areas, because being a parent, having a career, even if you're not a parent, as an adult, there's a lot of things to balance at any given time. And so it's really important to take a step back and look at different areas that potentially might be impacting your own mental health as a parent, to then be able to find a little bit more balance. Maybe you need to, take some more time to focus on relaxation, getting your basic needs met, sleep hygiene, physical activity. So really working with one of our parent support specialists, parents will be able to explore these areas and figure out, is something missing? Is there a big gap in some of these? And then how to navigate that, and potentially make changes that will impact that parent positively, that will then impact their children. Okay. So this just goes right into self-care. So all of those different areas, it is really important for parents and caregivers to take care of themselves. Rachel can attest to this. We have parent support groups. I do presentations. She does presentations on just how important self-care is. And I think it's honestly a topic that gets talked a lot about, like, oh, self-care is so important, do self-care. But really, people are really bad at it. Parents especially are terrible at self-care. Some people, I will say, do really well at it at times, but self-care is something that really goes on the back burner when things are not going well. And that is the time where we need to make sure that self-care is being done to be able to navigate some really challenging situations that our families face with their kids and just as a family. So this is just an idea, some general self-care strategies. But what we talk about a lot is when someone is struggling with self-care, typically that is because things are not going well, with their kids, with themselves, maybe their own relationships, their needs are not being met. And so we also acknowledge that self-care is really easy to talk about. It's not easy to make a part of your life consistently. And so especially when you're faced with, maybe your child has severe, emotional distress, things are a really big struggle at school, at home, maybe you're facing, or a parent is facing, suicidal ideation, unsafe behaviors, physical aggression. Those things really can consume a parent's life, and that gets overwhelming. And then, someone is then trying to recommend, well, take care of yourself, do some self-care. That is easier said than done. So our services, we do a lot of one-on-one support, focusing on this topic in parent support groups and our classes, to really help parents figure out, what are the barriers, what's keeping me from being able to take care of myself, to then, be able to manage the really stressful things, that they have going on in their lives. So we also have part of our services guide is a self-care calendar, because we know that you're much more likely to do something if you actually put it on your calendar. I am very guilty of that. So planning for self-care, making it a part of just your daily, weekly, monthly routine where you're really intentional about doing something that as a parent is just for you. I think sometimes parents will disguise self-care in something that they maybe already were planning to do, or like, oh, I took a shower this week, that was my self-care. You deserve more than just a shower. So making sure that self-care goes above and beyond, our basic needs, things that really fill up your cup, that are meaningful to you, and that really re-energize yourself, your mental health, so that then you can tackle mental health struggles of your kids, of family members, maybe career stressors, being consistent and intentional. Okay, so that brings us to our parent support groups, which Rachel is going to talk a little bit more with us about. It's just one of our next steps in our parent support services that we offer.
Yes. So we started the weekly parent support group during COVID because we were like, we need to give these parents an opportunity to connect. And how can we do that? So we started weekly Zoom groups, and I guess, wow, COVID was like 4 years ago. So we have been having these groups. We do them 6 weeks at a time. So we've been having them, we do 6 weeks, take about a 3 to 4 week break, and then just continue that cycle. And we've been doing that for 4 years. So what the goal of the group is for parents to have a safe place that they can come and they can talk about their children and not feel judged and feel safe in that environment. And I always tell the parents, we've never, ever, and Jordan Books and Jordan Marlowe can attest to this, never, ever have we had a parent share something, no matter what the behavior is, no matter what the parent is feeling, and not have another parent validate that, relate with that. It's never happened. So our goal of making it a safe place where parents can come and talk about struggles, and we do talk about celebrations as well, we accomplish that goal, and we continue to accomplish it weekly. So we do something strength-based brainstorming. So what we do is we give the parents an opportunity to come to the group with a struggle, or even if they want resources, whatever they're looking for. And we then allow the parents and Jordan Marlowe and myself, and when Jordan Books attends, we all just like popcorn, brainstorm suggestions, resources. And what we ask the parents not to do, and we actually modeled this after our own team strength building process, is we ask the parents not to say, I've tried that, that's not going to work, that's the worst idea I've ever heard. We don't want them to say that's the best idea, because we want other parents to utilize that and not base it on another parent's experience, because what works for one may not work for the other, and vice versa. So we have seen a lot of success with that strength-based brainstorming. So, and the other thing that we really wanted to make a goal of this weekly group is parents to build a connection with other parents for when they close to services. So the parents are able, if they want to, share their contact information. I always tell the parents, we will never share it, but they are open if they want to share it. And we've seen a lot of friendships form. We've seen the parents' kids form friendships. So it's just an extremely beneficial weekly group that we've created. Jordan, do you have anything, anything else to add to that?
No, just really echoing what you were saying is, so Rachel and I did these groups together for a long time. And even like ourselves as parents, it was amazing to see the ideas and the resources and strategies that parents came up with. I left every group with some sort of resource or idea that I had no idea about. And so it really is like the power of the group coming together and just throwing out ideas, even if maybe it's not something that works for that person. Like Rachel said, we don't limit it. And so, sometimes we leave the group with a list of 40 plus ideas that then, Rachel will send out to the parents to have just moving forward to use whenever they need to. So, those groups, even for mental health professionals, attending and facilitating are just extremely powerful to see the connections that are built with the parents, and just their confidence leaving on feeling even just a little bit maybe better, or feel a little bit more confident on how they might manage some of the really intense and hard things that they're going through.
And Jordan, I just wanted to share one more thing I just thought of, which is a huge benefit. So we have parents whose children have been in services for several years, and they come to the group and they're struggling and they're just looking for support and they feel so desperate and lost. And by the end of services, it's not always, it could be, a year, it could be several months. By the end of services, they have become these like advocates for the other parents. And we allow the parents to pretty much run the meeting, right? So that is, to me, is one of the most beneficial things that come out of those weekly parent support groups, is when you see a parent just struggling to becoming the parent who is supporting other parents and is that light at the end of the tunnel parent. So that has been extremely beneficial.
Yeah, I'll share too a little bit about I'm in a lot of like the autism mom groups and stuff like that in the area, and I've seen like former clients on there supporting other parents and saying like, hey, there's this parent support group that I go to, and it's strangers, people they don't know. So it is a really beautiful thing to be able to see them go from kind of like sometimes a little bit lost, feeling really defeated, feeling like a bad parent, which obviously that's not true, and then kind of going to that other side and becoming the advocate, which brings a lot to people.
Absolutely. And I think, one of the things that we talk about a lot of different things in the parent support groups, but just the amount of information that's out there related to parenting is overwhelming. There's, you can Google any day, some sort of symptom or behavior, and you're going to get, 100 different ways of managing that. And so, really what's important is what works for that parent and that family. We might give suggestions, but those don't always work for everyone. And so I think that in the group setting, we're able to just talk through a lot of the different ideas and strategies that are out there for parents to really figure out, okay, what might work best for me or for my child.
And Jordan, we did just have a question. So yes, dads do attend the meetings, and I'm probably saying moms, and I apologize for that. It does seem that there are more moms, but yes, we have had couples join the meetings. We actually have had grandparents, grandfathers, but yes, dads do join the meetings as well. There just seems to be, for some reason, more moms, but we usually do have 10 plus parents. It's been a long time that we've had less than that.
Mm-hmm. Okay, awesome. Thanks, Rachel. So we talked about individual parent support, our parent support groups. Parent Connect was one that we also developed really just in response to people closing to services, or people that are maybe not connected to the mental health center's level of care, that were still wanting some sort of resource or connection in the community. And so we created Parent Connect, which really is a parenting series that now we have one of our prevention coordinators is going to do that ongoing, Tim Cruz. But really what it is a way for us to continue the conversation, to bring in community experts, to talk about parenting, mental health, things that are really impacting parents in general or the community. And so typically we partner with maybe a mental health professional, another agency within the community, to provide resources, information on like hot topics, if you will. So this is an example of one that we did prior to the summer screen time. In the summertime, we partnered with Screen Sanity to really talk about the struggles with technology and kids. And I can't see anybody, but usually everyone is like, yes, that is a huge struggle. We know nowadays that kids have cell phones, access to social media way earlier. My daughter always complains about that she's the last person ever in her school to not have a cell phone, which honestly probably is correct. And so they have just a world of resources of information at their fingertips. And at such young ages, sometimes they don't know what to do with that. Then they have, people potentially not being very nice over social media. We know that, when things are not in person, sometimes can get much more hostile than it would in a direct one-on-one person conversation. So our kids are dealing with a lot of stress outside of the family as well, through social media, with friends. And so this Parent Connect was a way to just get information on how to, use technology safely, managing mental health, and the barriers or things that can get in the way of managing mental health related to technology. So that was a really great one. Rachel can probably tell a lot more of the topics, but we do a ton of different Parent Connects on, depression, self-injurious behaviors, suicidal ideation. We partner with co-responders in the community to talk about like 988, co-responder support. We're actually, I think that's my next slide, but we have one that's tonight, which I have not confirmed if you can still register.
Yes. So Jordan, I did talk to Tim Cruz. So if you do want to register for this, the link is closed, but Tim Cruz, I know you're on here. I'm hoping you can put your email in the chat. If not, I will do that. And you can email Tim and he will send you the Zoom link. So I just got that confirmation.
Perfect timing. So yes, this is one of our Parent Connect sessions that's tonight, 5:30 to 7:30. We're actually partnering with Children's Mercy to provide information on autism. So again, these are offered. They used to be monthly. I would say, they're not necessarily every month, but it's just whenever we have things that are going on within the community, or ability to partner with someone else to provide something that, is relevant related to parenting and mental health. So a great resource within the community. You do not have to be a client of Johnson County Mental Health to be able to access this. And this is typically shared on like our social media accounts, our website. So please, if you're interested, you can always forward these. It's really open to any parent or caregiver within Johnson County. So please use that resource. Okay, so Jordan Marlowe is going to talk for a few minutes on our parent project. These are a couple of different classes that we have to offer to parents of clients that are served by Johnson County Mental Health, but also the community. Take it away, Jordan.
All right. Parent Project Junior, or also known as Loving Solutions, is a parent training program specifically designed for parents raising difficult younger children ages 5 to 10. A special application to ADHD issues. Loving Solution employs a behavior model to help parents both motivate children to do so, to do constructive tasks and manage unwanted behaviors. A little bit of history about Parent Project with us. We started around 5 or 6 years ago. Is that correct? A little bit before COVID, we were able to have one in person, but due to COVID, we shifted them over to Zoom. And we found that parents just find it much more convenient to continue to meet on Zoom. So that's where we do meet every week. We host a couple of parent projects a year, one, usually 2 of the junior, 2 of the senior. Parent Project Junior does a really good job of laying the groundwork for designing strategies for those difficult behaviors that parents see in home, in the community, and also at school. Some of the different strategies that you'll see if you come to a Parent Project Junior session is we talk a lot about self-limiting and different styles of timeouts that parents are able to use. One of the really neat things about both of the parent projects is that after the 10 to 11 weeks of facilitator-led training and education, the groups more or less morph into another type of parent support group. So the parents take over and they run their own group. They can either meet up on Zoom. We've had parents that meet up at restaurants, libraries, parks. Then they continue that support group format. Moving along, you'll see the slide for our Parent Project Senior. Once again, it is going to be another 10 to 11 classes. This kind of depends on how we move along through the book. The goal of it is for a group of parents to create a bond for ongoing and continued support outside of Johnson County Mental Health. Some of the issues that we do cover in Parent Project Senior is refusal to help around the house or with compliance, unsafe social media usage, as Jordan Books already mentioned. We talk a lot about alcohol and drug use, and we do cover some of those more severe behaviors. So we do cover some issues with violence in the home and some gang activity. One of the things we really enjoy about Parent Project Senior is we have been able to partner with several different organizations and people from the community where they do come in and offer some of that shared life experience in these areas. We are able to partner with our outpatient service, AOAS and ACT, and they do come and talk about current drug trends. We have been able in the past to partner with a gentleman who does have a lot of information regarding gang activity in the area. So just really a lot of good information, but more than less, what we want for anything is parents to be able to complete the class, put a couple new tools in their tool belt, and then they're able to continue on in the support group where they're able to connect with parents who are going through a lot of the same issues that they're going through.
And to add to that, Jory Marlowe, I saw a parent just recently who had taken our first class in person 5-ish years ago, and they are still meeting some of the parents. So it's very similar to that weekly group, the connection that is built between the parents, and to still be meeting all these years later is extremely impressive.
Yes, thank you for that.
That is really impressive. Thanks, Jordan. Okay, so we're just going to briefly touch on Family Mant, and Rachel's going to share a little bit more, but this is a class that we teach typically for parents of clients of the mental health center to learn de-escalation techniques and really just be able to parents learning how to manage their own emotions and regulate themselves to effectively communicate with their kids, but also really model, for kids what to do in certain situations. So go ahead, Rachel.
Yes, there's not much more than that. That's exactly like the goal of Family Mant is we cannot de-escalate an escalated child when we're escalated. So it really just works through the importance of Maslow's hierarchy of need. Like, are they hungry? Are they tired? Are all their needs being met? Right? Really to try and figure out what the trigger is to the behaviors. They talk about the crisis cycle and each part of the crisis cycle and options to give. And it's really about learning how to respond to your child in a positive way, build that connection, all about body language, active listening, I statements. So that a few other strategies, but all really based around how to respond to your child. It is extremely beneficial. So the whole goal of Family Mant is just so the child feels safe, the parents feel safe. I really think that's it as far as Family Mant goes. Parents do find the strategies extremely beneficial, and it's good reminders.
Thank you, Rachel. Okay, so that brings us to Sibling Connect, which is our newest addition to the different services that we're providing parents and families through the mental health center.
Okay. Hi. So I'm Geneva. I have worked together with Jordan, and Rachel to get Sibling Connect going and off the ground. The way that it kind of started was I had a client that their sibling was really, really struggling with what they were experiencing and seeing, being hurt by their sibling, that kind of thing. And I was not able to find a resource anywhere in the area that was going to work for them as far as like being covered by insurance or not, or not an hour and a half away from them for a sibling support group. So I started asking around about it and started darkening Jordan's doorway a little bit more to, advocate for it. And here we are. So we had our first pilot group and it went fantastic. It went great. We had a great turnout. Almost all of the kids said they wanted to come back, and I think only one of them was lying. So that's good. They enjoyed it. So yeah, we will kind of get into that a little bit more. I also would like to say that this particular group is very uniquely qualified to be facilitating this group. Each of the facilitators have a sibling with some kind of special needs, severe and persistent mental illness. So it's very important to us as people, that we get to do this. So the way that Sibling Connect so far has kind of run is we have two parts of it. The first part is the actual support group with the kiddos. And then after that, we have a Zoom with parents that, we can kind of answer questions that they might have. We'll share you know, what we may have learned from the kids during the support group, you know, what like further supports might be needed, that kind of thing. And we had a good turnout for that as well. So we're really excited about it. Kind of the main focus, you know, when we do these groups is to build that sense of community, help kids, you know, siblings know that they're not alone in what they're feeling. A lot of times we find that kids are really struggling with not feeling validated. You know again, that lived experience of what makes us uniquely qualified. My parents have severe persistent mental illness as well as my brother, and then I have a child with autism. So I kind of cover all the bases there of being able to you know, kind of touch on all of those different ways. But what a lot of our kids were saying was that they just weren't feeling validated by parents or, you know, or other people in their life. Like, you know, if they're coming with some kind of concern or wanted to vent a little bit or be like, hey, this is scary, it wasn't as helpful for them to be met with, you know, more diagnosis education. You know, this is the thing that your sibling struggles with. These are the therapies we're doing to try to help. You know, that's a very solutions-based focus, which is great and often what we teach. But what we were hearing from the kids was they wanted a little bit more of, you know, yeah, we know it's hard. Like, it's not fair that your sibling might hurt you. You're right. So that was a big takeaway. The activities that we did, this first one that's on the screen here, we did vision boards where kiddos were able to make kind of a vision board for themselves and what they wanted for their future, what's important to them. And then the other side were things that they felt represented their family, maybe not necessarily even just their sibling that they were at the group for, but like their families in general. So it was a really great way for us to kind of build that initial rapport with kiddos and help them feel a little bit more comfortable as they were coming in, just kind of doing this fun art project. We had snacks and that kind of thing available. And then kids were given the opportunity, and facilitators as well, to kind of share our vision boards and why we put on there what we did. So yeah, it was a really great experience. And then we also did an activity where we had a bunch of different questions put into this treasure box, and the kids were able to pick out those questions and answer them if they wanted to, or, you know, pass to the next person. And it was just things like, give an example of a time you felt this in regard to your sibling, that kind of thing. And that was really great for the kids to be able to feel like they could say whatever they needed to say and not feel like, you know, that means that they don't love their sibling, right? Like, I am queen of telling people that "and" is the most powerful word in the language, because you can feel two things at once. We can love our sibling, we can love our kid, we can love our family member, and also be really frustrated with them. So that was something that we were kind of hearing a lot from the kids, and also that they were worried about their parents. They wanted to know that their parents were safe, that their parents had their own self-care, and that their whole lives weren't being taken up by, you know, trying to provide the right support for their sibling. So that is kind of the gist of how Sibling Connect came to be. We're hoping that we'll be able to have, you know, at least 2 a year. We're kind of still working out the kinks in that of what that's going to look like. And one of the really great things that we saw out of our first session was we had parents in the parking lot after exchanging phone numbers. We had kids that wanted to hang out with each other, that suddenly had this group where they didn't have to feel like they were going to be embarrassed if their friend came over and their sibling had some kind of crisis, or, you know, if their sibling was, you know, eloped in the middle of a movie that they were going to see with their family, invited a friend to, that they weren't going to have to, you know, really worry about their sibling or their friend not understanding that. So it was a really great thing. And then, you know, kids that, the parents being able to exchange that information too, kind of built that natural community as well, because suddenly now these parents are setting up play dates for the siblings of their kids that are in services. And they're able to kind of, you know, build that sense of community more and go to each other for different resources that they might have heard of or frustrations that they're having, and not have to worry about that stigma that unfortunately still exists. One of the other really cool things that we had come out of this was one of the kiddos that attended the group went to their parents after and was able to say, hey, I'm really struggling myself. I think I'm depressed, and I didn't have the language for that before. We had age range from, I believe the youngest was 7 to all the way up to 14, which was also really cool because those older kids kind of acted like these natural mentors for the younger kids, you know, which gave them a sense of responsibility and I think a sense of purpose of like, you know, maybe potentially a little bit of, oh, I can use this experience that I've had, you know, to help other people. So that was really great.
Hey, Geneva, I'm just going to answer
Yeah.
this question. We
Okay.
just got, so our Sibling Connect is just open to those who are clients, siblings of clients in Johnson County Mental Health, and Parent Project is open to the community, but at this point right now, we're finishing them up and don't have any future dates as of now. But if we do, they usually are on the Johnson County Mental Health Facebook page, website. So those are just some questions. And the ages are 7 to 14. That is correct.
So yeah, that is kind of the gist of that. If there's any questions about that, any of us, you know, can answer those as well. Yeah.
Awesome. Thank you, Geneva. Okay, so
Jordan, there's one more question. I'm just gonna, which
Yes,
I'm
go
gonna
ahead.
direct to you. Would you have any resources or guides you could share about your parent support, family man, etc., for those of us who may be interested in developing these groups in our agencies?
yeah, I mean, I'll reach out to us. I think that we're definitely, you know, we based a lot of this off of just like the strengths-based model of case management, like really building on strengths. We have, like the way that we typically run the groups. So we would definitely be open to collaborating, you know, with others who are wanting to, you know, potentially build their parent support services and want a little bit more guidance. You can always reach out to really any one of us.
No, with Sibling Connect specifically, the way that we kind of were able to get it started was I had attended a group as a kid that through, you know, out of state, other side of the country. So I was able to kind of go through, like I looked up that group, I was able to remember that and be like, oh, okay, like maybe this is some curriculum we could use, that type of thing. So I think looking up other people, what other people have already done is a really great way to, you know, start to build something ourselves.
Okay, so we threw a lot of information at you. We have a lot of services, you know, that really are geared toward families and parents specifically. So please, you know, type in your questions. We have some time to be able to answer any questions that you all have. But overall, we just really thank you for being a part of this. We would talk about this all day long. So this is not even, you know, really a job to us. We love being able to share about just how important parents are to their kids, and also just how hard parenting is, and really being able to make time for your own mental health, your own needs, because really you can't pour from an empty cup. It's so really so true. Parents, we give a lot and we prioritize a lot of other people's needs, and then there's not a lot left over for us. And that really then can impact our ability to manage our own mental health, to be able to take care of other people. So again, parents are so important and really key to, you know, providing mental health services for kids, really involving the entire family system is really what we're all about. So please, you know, follow us on our social media, our website, Instagram, all the things we're all very involved in. So you can find additional information through our social media. And we definitely want to be open and available for your questions. So with that,
Jordan, it looks like Diana Rose has a question, but I don't know if she can unmute. I don't know how that works.
yeah, maybe just type it into the Q&A.
Okay.
I see some thank yous. We really just appreciate anybody showing up. So we appreciate you all.
All right, there is nothing in the Q&A at this point.
Okay. Well, I just want to thank you guys so much for such great information about what can be available for parents and siblings. We're getting a lot of thank yous in the chat. And I know I learned some new information about what's out there. And so that's really exciting. So a couple quick little announcements. So again, our Mental Health KC conference coming up May 23rd and 24th at Johnson County Community College. It's all day, May 23rd, half day, May 24th. So you'll still get out at noon on the 24th on Friday, have that rest of the day to do whatever you want to do. So, with that, I am going to put in the information about getting the certificate of attendance. And last chance, anybody have any questions?
Yeah, there's just, do you do, kind of similar to the previous one, do you do consulting with agencies that want to develop these supports? So Jordan, is that just reaching?
That's probably me. So,
Yes.
sorry. I was like,
That's okay.
good question.
Oh my God, no.
Yeah, I mean, I would definitely say reach out, to Janie Yanacito or myself. And I think we definitely would be open to, sharing information and just, further collaborating with other community providers. Oh, and then will the slides be available? That's another good question. I don't know that we have plans to make them available, but I guess, if someone's interested or interested in further information, again, please reach out. We have a lot of information that we can provide.
I will tell you guys that the webinar it's being recorded right now and will be available for everyone on the Mental Health KC website. So mentalhealthkc.org. And hold on one second. I'm putting up the information about getting the certificate. So hopefully everybody can access the certificate. And with that, I want to thank you guys again. So I hope everybody has a wonderful rest of your day. And we look forward to seeing hopefully all of you in 2 weeks. And the topic is going to be May 9th, I believe. Thursday, May 9th, 12:30 or 12 to 1. And it is on Journey to the Mind. So talking about using different parts of our brains. So thank you guys. Have a wonderful rest of your day.
Thanks, everybody.
Thank
Thanks so
you. Bye.
Bye.